All right. Thank you, everyone, and thank you so much for being here this morning. First of all, I want to thank our media partners. You have always been so incredibly helpful helping us get our messages out. We're very grateful. I also want to remind everyone that this will be streamed live on our YouTube channel. So, do you have a link for that, John? All right, perfect. Thank you so much. Um, First of all, I want to start off by saying a few months ago, I reached out to some of the best and brightest experts working on COVID-19 in their expertise and in the field. I want to say it's really been interesting because when we have sort of natural disasters or things of large magnitude, we really typically tend to rely on our public safety, like our firemen, our police officers. Those are the people we sort of reach out to. During a pandemic, it's very, very different. And so it's incredibly important to reach out to our medical community who are working on the front lines of COVID-19. So I want to say I'm incredibly grateful for their knowledge. I have learned so very much, and I can't wait to share that information with our entire community. So I think it's been extremely helpful. And so first, I'd like to thank our panel members who have joined us here today and here to answer any questions and explain this project. First, I'm going to introduce Dr. Eric Nielsen. He's an emergency specialist fighting COVID-19 right from the ER, so he's seen the effects of COVID-19 firsthand. We also have Dr. Jeremy Smith. He's the executive director of the Truckee Meadows Regional Planning Agency. He's incredibly brilliant. I would like to call this entire panel, everyone that has been on this advisory panel, like a dream team. I have to tell you, I'm so impressed that our region has this kind of talent. So thank you so much, Dr. Jeremy Smith, for being here. We also have Naomi Dewar, fellow Reno City Council member, no stranger to any of you. Then we also have Heather Curran. She's an epidemiologist, and she's the program manager at Washoe County Health District. And your knowledge blows me away every time we speak. So I just want you to know I'm super grateful you're here. And we have Dawn Owner, Chief Operating Officer of Acute Services of Renown. And I can't wait to tell you what Dawn is working on. We built a great partnership with Renown. It's very exciting. I think the community is going to be very pleased, so thank you so much. And then we have the wonderful Christopher Dare from the city of Sparks. He's a council member there, in case you don't know Christopher Dare, but everyone does. And sometimes his day job, he's a preacher, right? So thank you so much, Councilman, for being here. But before we get started, I also would like to thank the rest of the panel experts that assisted in this effort with all their hard work. Without their dedication and time, this wouldn't have been possible. So I want to introduce you to some of them. They're not here in the room. We kept it very socially distant, and we wanted to make sure we were following every guideline possible. But I do want to introduce you to them because they are all remarkable community citizens and experts in the field. First, we have the amazing, and he's my key researcher. He truly blows me away with all his research, and I'm super grateful, is Dr. Ron Ariel. He's a pediatrician, and you should see him up there on the screen. We have Dean Dow from REMSA. We have Dr. Brett Fry from Northern Nevada Emergency Physicians. He's also working on the front lines in the ERs fighting COVID-19. We have Jack Hester. He's from Brown University School of Public Health, and he zoomed in the other night from school. He went back, and we were so grateful to have him for the last few months, and he's incredibly brilliant. We also have the ever so talented Julie Lucero from Dr. Julie Lucero from the University of Nevada, Reno. And she has done a phenomenal job talking about our minority populations, how we reach them, and how we can assist in every capacity to make sure that we do all we can to get out in the community to offer services. So she's been amazing. And then we have Stephen Polikalis. He is attorney at law, president East Shore Communications and Government Affairs. We have Ann Silver from the Reno Sparks Chamber of Commerce. She's our business champion, as you know. Does an amazing job in our community. I want to thank her for our business grants rollout. And we'll talk a little bit about that program at the end of this presser. And then we have Dr. Richard Simmons, University of Nevada School of Veterinary Medicine. And he's been really interesting to talk to, and we're going to have a series of these pressers and bring them in from their different specialties, because I think all of them bring in something incredibly unique, because people were asking, do pets get COVID-19? And so he brings a lot to the table when it comes to veterinary services. We also have Dr. David White, who is incredibly impressive, and he specializes in dentistry. And I know many people have been concerned about, should I be going to the dentist and what precautions should I take? And so he's been extremely valuable to the conversation as well. So I want to thank all of these dream teamers. You guys have just been amazing and blown me away with your information. So I want to say thank you. Without you, this definitely would not be possible. So I also think that this is a time that so many of us are feeling anxiety and stress, and we're hearing so many stories of gloom and doom. And I got to tell you, these experts brought hope. They brought hope to me, and that's what I really wanted to share with you. And at first, it was just conversations and questions asking our medical community, and that's really what it is. And then we started to feel like like many of you probably feel helpless. Like, how can we help, fight COVID-19? What can we do? And it's also a virus, so it's very hard to see and wrap your head around. But everyone kept saying, Mayor Sheevy, what can I do for our community? What can I do for our community? And then this panel of experts started to talk about, is there some way that we could build something that could be a tremendous tool to help our community to feel like they could have some power? And so we are hopeful that these tools and partnerships that we want to share with you today will help us fight this pandemic. No doubt this has been one of the most difficult times. Certainly, it's one of the most difficult times I've ever faced, and I know many of us are struggling from the hardships of COVID-19, so I really want to recognize that. And sadly, friends and family have lost their lives, and businesses are struggling and literally hanging on by a thread or have closed. And again, that devastates families. So I really want people to know this is something we take incredibly seriously. I do want to reiterate that these experts reinforce hope, and they also really understand that modifying behavior can help us fight this pandemic. And they also really stressed that this comprehensive data and metrics that we produced, and we're calling it the COVID risk meter. And it's really about modifying your behavior. And people keep saying, what do those numbers mean? And they don't understand a lot of those numbers that you see every day that come out from the health department. People don't really understand, how are we doing? And they don't really understand how to measure that. And so this was a fascinating way that these experts came up with to produce this COVID risk meter so that we could put the power back into your hands. And especially someone like me, I have comorbidities because I've had a kidney transplant, so I'm on immunosuppression drugs. So for me, I have to look at that meter and decipher, hey, maybe I want to take less trips to the grocery store. Maybe that's something that I need to be very aware of. I also want to point out, I think this is super important, that we are not Southern Nevada, and our population is it's very different. And our numbers, I want our numbers to reflect the progress that we are all making in our own region. So I think that is really critical to Northern Nevada. And this is another tool that we can do that with. So I wanted to certainly point that out. We believe the Truckee Meadows risk meter is very much like the pollen count. And many of you are super familiar with the pollen count. And it gives the power back to the people by putting information into their own hands to make their daily decisions. We also know that modifying our behavior is the only way, and I'm telling you this until we have a vaccine, it is the only way to protect us from COVID-19. But these experts stress in our community that this important information, we can stay healthy and safe while keeping our economy going. And we know this is the biggest weapon to fighting COVID-19, is modifying our behavior. And that's what this risk meter does. So this tool also, again, I said it was designed like the pollen count, but it's also very much like the burn code or the air quality meters that we're all used to watching and following based on our individual risks, and make it very simple and easy to follow daily. I also want to stress this is not used in any way for shutdown threats or matrix, so that's really important to stress. It's really a daily reminder and educational tool on how we are doing modifying our behavior. And I'm really excited to introduce Dr. Eric Nielsen. I've just been so impressed by your work and everything you bring to the table. And I think this community is so fortunate to have you and all the work that you're doing. But I want to say, you know, some of your stories have been heartbreaking, but they've also been heartwarming. So you've given us a lot of hope. So I want to say thank you, and I want to turn it over to you and talk about why you think the COVID risk meter is so important.
Thank you, Mayor Shivi. Thanks for everyone attending our forum this morning. I'm Eric Nielsen, a local emergency physician, concerned citizen, and a born and bred Northern Nevadan. I am not an epidemiologist or a public health expert, but I do understand how COVID-19 affects the patients I care for, as well as the community we live in. I'd like to thank all the members of the Mayor's COVID response team for their participation, and particularly my colleagues on the subcommittee that developed the risk meter, Dr. Ron Ariel, Councilwoman Doerr, Jack Hester, Heather Curran, and Dr. Jeremy Smith. The question of the day is why develop the risk meter? Everyone's been inundated with tons of data and dashboards that measure COVID-19. Whether it's the Johns Hopkins Global Tracker or our local health district's website, concerned citizens are seeking ways to monitor the disease and its effect in our community. The numbers can be confusing and overwhelming, and we hope our project brings some clarity and simplicity to a murky situation. We took a local look at the data and sought a way to inform our citizens how the pandemic is affecting our population. As Northern Nevadans, we all understand the concept of a burn code regarding forest fire risk. When you see the word extreme posted outside the fire department, you understand that it's probably not a good idea to spark up the backyard fire pit. We have the same questions and choices regarding COVID-19. Is it safe to go to an indoor restaurant? When can I feel comfortable gathering with indoor friends? Do I want to go to that backyard barbecue this weekend, even if I know there might be 30 to 40 unmasked people there? We took into account various conditions and data, just like a burn code does. Is it windy outside? Are thunderstorms or a heat wave in the forecast? In our risk meter, we identified 5 key metrics, just like, pardon me. In our risk meter, we identified 5 key metrics that we feel best reflect how threatened our community is by COVID-19 on any given day. Are a lot of people seeking COVID-19 testing? How many individuals are testing positive in the last couple weeks? Is the percentage of positive tests getting dangerously high? Even if people are getting COVID-19, do they require medical attention or hospitalization? And perhaps more important, can our hospitals handle the surge of the sickest COVID-19 patients? You'll notice we excluded certain data points, such as deaths, because it's a lagging and terminal indicator, but included leading indicators, such as exposed or symptomatic people seeking testing. We may include other metrics, such as mask compliance in the future, but for now, these are the data points we feel best gauge our local COVID threat level. We envision this risk meter as a tool our community can rely upon to give local, up-to-date data regarding COVID-19 and a way to influence behaviors that promote its spread. We do not intend our meter to supersede any of our governor's mandates or public health district's recommendations. We caution businesses and the school district not to strictly rely upon our meter. We do hope it can provide a one-stop shop for concerned citizens to check in and get a feel for how we are doing as a community. Although we've already spent months developing the risk meter, understand that it may evolve as we have more data and experience with the disease in Washoe County. Although, pardon me. So without further ado, let's pass it on to Dr. Jeremy Smith and Councilwoman Doerr, and they'll walk us through the website and get us into the nuts and bolts of the risk meter itself.
All right, Jeremy, the floor is yours, my friend.
Thank you, Madam Mayor, and thank you, Dr. Nielsen, for that intro. And I just want to echo everything that you said there in terms of our mission creating this meter. And just thank all of the volunteers and people that have served on the team to get us here. I've been incredibly impressed, and I'm just really incredibly impressed by the response of our entire community. I think we've done a great job here in Northern Nevada. And, I was excited, super excited to be involved in this effort. It didn't take any prodding. I wanted to join in. I have certain skills I got working with tree rings, actually, and time series data that helped make this something that I could do. So it was really fantastic to be involved. And I'm very excited that yesterday the Regional Planning Governing Board voted unanimously to support this work as part of the official work program of the TMRPA. And so I think that's really going to be helpful in allowing us to continue to improve this and move forward. So fantastic. But let's get into the slides, please, and what we have here to show you today. So it starts when you get to the homepage, which is right now hosted on tmrpa.org. COVID-WC, so it's tmrpa.org/COVID-WC. And you can see that as soon as you arrive to the website, you see this gauge. Pretty simple, 5 colors moving from green through yellow, orange, red, and all the way to purple that describe basically the severity of risk, the state of affairs due to COVID in our community on any given day. Along with each color, the doctors and medical professionals on the team have come up with a set of guidelines that folks can read and associate to that color that can allow them to make changes or decisions in their daily behavior that can help us minimize the spread of COVID in our community. So every day, data is updated, and we collect data from the internet, and we have a couple of emails that come through, and we fill out our data matrix, and then we run this all with Python code, all open source stuff that runs and automatically updates this gauge to tell us what our risk is looking like on any given day. And so it was super important that we built these data streams and that they were daily and they were consistent and reliable. And so there's been a lot of help from folks like the Department of Health and Human Services at the state, the Nevada Hospital Association, the Washington County Health District has been fantastic. And also the GIS guys and the IT department over at the county that put up that dashboard is fantastic. So we're using all as local data as we can get to create this meter. Next slide, please. These are the 5 data indicators that we were able to choose, basically across a continuum from leading indicators all the way to more lagging indicators. And I'll go through those now one at a time here. COVID risk assessments. This is a reflection of how many people are calling in or going online at the health district to request a test. And so the idea being here that this is our first chance to find out if things are flaring up. If a lot of people start calling for a test, then our model is going to pick up that trend is increasing. Then we move on to COVID test positivity. This is really a measure of, are we getting a handle around this disease in our community? Are we testing enough? Obviously, we want these percentages to be low, and so we're tracking that in our model as well. Also very important, the number of new cases daily. We've adopted Harvard Global Health Institute's class breaks for our model and normalized that data by our population. So it's new cases daily per 100,000. And basically, we've been in the 3rd score category for that for the past few weeks. And I'll show you that data. And then the last 2 are coming from the Nevada Hospital Association. And the first one, indicator 4 there, is medical interventions due to COVID. So this is how many hospitalizations are required because folks have COVID? Or if you go to the hospital, how many folks are being sent to the ICU because it's severe? So that's an important measure as well. And then finally, hospital capacity, as Dr. Nielsen mentioned, we want to make sure that, early on we talked about flattening the curve and making sure we didn't overwhelm our hospital staff. And so our behavior can help keep those hospitals open, and that's what we want to achieve. So each of these data indicators in our model can score from 0 points to 3 points. And the highest possible score is 15. So now I'd like to show you, we back calculated about 60 days worth of our model, and you can see how it operated. So on the right there is the scale, how we get from green, yellow, orange, red, and purple, and there you can see the model scores from 0 up to 15. And then the graph at the left is showing you the performance of our risk meter daily back to about the end of June. And so you can see right around the 4th of July, there was obviously we had some reopenings happen. People were gathering for the holiday, and you can see a spike. And we actually did hit into the red part of the meter in that time frame. Since then, we've come down and been moving between a high yellow condition and a low orange condition. On the meter, we wanted to put a little bit of gradient in there so that folks could, in the public, you could be aware that, okay, we're yellow, but we're tending towards orange, or hey, we're in the high orange, we're tending towards red, and that could put a little more emphasis on making those behavioral changes that'll help us, de-escalate. So we feel like this is capturing, the case data and the other data pretty well and doing a pretty good job. That said, this kind of work is never really complete, and we're going to continue to try to improve, the validity of this, validate the results, and as we get better data, hopefully fold that in and continue to make this a resource for the community. So I just quickly want to take you through a few more slides that actually show the data that feeds into this. We want to make sure that you have access to see what is driving this model. So if you go to our website, again, that's tmrpa.org/COVID-WC, you'll be able to find graphs like this that we're working to have updated daily. This first one is talking about the risk assessment data. And before I get too deep, the bars in the background, you can see there's orange bars, yellow bars, there's a red bar. Those are indicating that same graph we just showed. Those are the model risk conditions that the model produced back in time. And then the black line is the data series that informs this indicator. And so in this case, it's the risk assessments. We do know there's a bit of a weekend lull in that data, so it is kind of spiky, and that's why we look at a 14-day slope to assess this indicator. Next slide, please. This next slide is test positivity. Again, there's those same risk bars in the background. And you can see there's two colors. This has been a tough one to pin down. There are many ways to calculate test positivity. Some are cleaner than others. And so we feel that now we're aligned with the state of Nevada. We've had conversations with the Department of Health and Human Services. And so on the very end there, you can see a black line. That's a reflection of the state's measure of test positivity that looks at total number of tests administered versus positive results. And so I was able to use that relationship and factor back data that had been provided daily about people tested in cases to come up with the dashed line. But going forward, we're going to be using the black line directly from the state. Next slide, please. This is our new cases daily per 100,000 people. You can see a few spikes in there, and this is a 7-day average. Most of the data is averaged to smooth it a bit over 7 days, so we don't get too much variability. But you can see it's been staying pretty consistently high, certainly in our third category of scoring for this. So this has been consistently adding 2 points to our model, new cases. Next slide, please. Here we have hospitalizations due to COVID. Overall, over the past several weeks, hospitalizations have been decreasing. So that's a fantastic thing. But you can see kind of towards the end there, maybe a slight uptick. If we go to the next slide as well. This one also participates in the medical intervention indicator, which is a kind of a dual metric. This is ICU bed use, also has been going down since that spike around the 4th of July. So a little bit of an uptick here recently that's driving some of that the orange bars you see in the recent weeks. Next slide, please. Here's the fifth indicator. Now we're talking about hospital capacity. And so we've been well within, we've had plenty of capacity, upwards of 30% capacity in our hospitals. The hospitals are doing a great job. This is total beds. Next slide, please. And this is ICU beds. So throughout the whole model, these aspects have been contributing very little, if anything, to the score. And so we're looking really good in terms of our hospital capacity. So the idea is all of these things work together. They're all happening simultaneously. And what our model is trying to do is just add it up, quantify, are all of these things up at the same time? And if they are, then we should be thinking as a community about altering our behavior to bring them back down. So with that, that's what I have today. I'm happy to later answer any questions.
All right, thank you for your brilliance. You have been remarkable. You blow me away. So you need to know that, Dr. Smith. It's impressive. Councilwoman Durham, I'm just going to ask you to speak briefly about the group that you've worked with. So go ahead.
What I have observed is that we brought together, as you mentioned, Mayor, some of the best and the brightest of our homegrown talent right here in the Reno-Sparks, Truckee Meadows area to kind of look at a problem and see if there is something that we could add to help address that problem. And really, as Jeremy said, condense information that's flying at us from the CDC, the WHO, from the state, from our local data. Everyone's trying to make sense of it, and the big question is, what does it all mean? And I think that this little working group has come up with a remarkable way to have no one indicator overshadow another thing. If all we cared about was the hospitals, for example, they're doing great, we wouldn't necessarily have an understanding of those that aren't sick enough to get to a hospital. If all we cared about was how many people were coming into the health district to get a test, and we didn't really care about what was the result, we wouldn't really have a very good understanding of what's going on in our community. One of the things I think that I just wanted to reinforce is that this is data that is specific to Northern Nevada. Most of the data that we've seen for our whole community has a lot to do with the whole state. How are we doing as a state? And much of it, since much of our population is down in Clark County, often what is happening in Clark County affects our numbers for the state. And I've so often heard, and I know so many have heard, but what about us? Aren't we doing a better job? Or perhaps we are doing more social distancing? Do we have less disease in our community? It's been hard to know until the development of this meter. And so now we are starting to get a better handle on very much more specific Northern Nevada data. And then finally, to sort of riff off something that Dr. Nielsen said, the gauge is a gauge, and it's designed to, as the mayor said, influence your behavior. I know that, for example, the burn code, if it's high or a danger or severe, that's very good information. Don't go out and do fires. But if it really goes to that top of that chart, people are going to take other behavioral modifications. They don't go out with their 4x4 pickup, which I use in my business. They don't go target practicing because they know anything can spark a fire. And I think it's informative in that way. It really helps us know what to do. And then finally, how can this data be used? There are many users. First and foremost is our public. They need the information in their daily life. But many agencies and organizations are also hopefully going to look to this data set and say, how does this inform our decision making? And I think that I can't really support enough the concept that you can't make decisions, especially if you're an organization or agency, just on one data set. You always want to look at the whole scheme, the whole environment, what you're dealing with. So while it's informative, you are in the driver's seat. If you run an agency or manage an agency, you have to take this in with all the other information. For example, if it is the school district, which I've heard a lot about, you have to balance out this basic information, what's happening in each individual school. Do you actually have students or teachers or bus drivers with COVID? How do you want to manage that? So there's so much that goes into any kind of decision making. What we hoped here, again, was a really easy to use tool to give you an approximate measure of what's going on in our community. Again, I can't say enough about this team you've put together, Mayor. These team of advisors, I've been very proud to be part of it and very pleased. Many people don't know that everybody's got a busy life, and everyone on your team does. But they made time, they volunteered, just like Jeremy, just like Dr. Nielsen. They came in after hours. They spent a lot of time together, rolling up their sleeves. And then finally, I guess I just want to reiterate, this will change. So as we get better data, we already see that the state is starting to evaluate how to do test positivity in a different way. Every development or intervention or new idea, we will evaluate and see if it has a place. Maybe it needs to be rejected, or maybe it will improve the end product. So with that, I just want to say it's a continuous improvement. And now that it's out in the public, we look forward to your thoughts on it. How can it be more useful to you in your daily life? How are the colors working? Does it really give you guidance, or is it just an approximation? And if you're a scientist, I welcome you to contact Dr. Smith, Dr. Nielsen, and talk about ways that potentially this could be improved. So thank you, Mayor, for an opportunity here.
Yeah, great comments. Thank you very much.
Yeah.
All right, at this time, I'm going to send it over to someone who I have been so impressed by. Her name is Heather Curran. You probably, many of you probably don't know her because she works hard behind the scenes doing an incredible job, but we have been so lucky to have you at the table. And she's an epidemiologist with the Washoe County Health Department. And I just have to say, you blow me away, and I'm so impressed, and thank you so much for your hard work at the health department. It's people like you that make such a big difference. So Heather, I'd love for you to talk a little bit about your work, talk about your participation with the meter, but also maybe a little bit about what's happening at the health department.
All right. Absolutely, and thank you, Madam Mayor, for having me be part of this group. and this group for really coming together and creating such a great way to have an at a glance at something that I think complements oftentimes the overwhelming data that informs the typical dashboard that you might see put out by local and state health departments. As an epidemiologist, we tend to see 4 distinct waves with COVID-19, and tomorrow actually marks the 6-month anniversary of our first diagnosed case, which came through March 5th of this year. The 4 distinct waves that we see is a really large influx in the number of people seeking a test, whether they're symptomatic or contacts to cases themselves. We see that as a first big wave. The secondary wave that we see is, of course, then the number of positives that result from those tests. And then, unfortunately, we tend to see the more lagging indicators as waves as well, the number of hospitalizations and ultimately the number of fatalities resulting as a direct result or related to a COVID infection. And what this meter and the indicators that are feeding into this meter really help us do is take all of those data, and often big data, and consolidate it into something that I think is easily digested by the general public and helps you really take into consideration your personal responsibility about the behaviors and the decisions that you'll make on an ongoing basis, whether it just be for that day, for the weekend, or throughout the rest of your week. I really do want to thank, again, this group as well for seeking a lot of input and insight from not just members of this group, but state, local health authorities and experts from across the country that I think helped lend a lot of credibility to the model and its ability to be useful and adjusting and modifying. And I think that we'll continue to make improvements, especially as science helps inform this pandemic as we move along in time. And I think one of the best things about this meter, and it's been mentioned before, is that we are utilizing local data, and often this is data that's not accessible by some of the meters and metrics that you'll see at a national level. So I think it's a really great opportunity and a testament to this community, with the goal, of course, to get ourselves down into the green. That would put me in an ability to sleep a little more every night. And I just wanted to go ahead and touch base on what we're seeing here at the health district. We do receive the confirmatory tests for all of our cases, just around 7,500 now in our community, and we know that there are others that have gone undiagnosed, but still may have the opportunity, unfortunately, to get to a severe enough standpoint that they do have to utilize our hospital systems, which I think have been fantastic partners in really making sure that they're providing the highest level of care to our community and to patrons and patients who have to utilize the hospital system. And we've definitely seen, a decline in our death rates, but I think even from the beginning, we've seen a lower fatality rate than some other communities around our country have seen. So a great testament to our hospital system and our providers across the community. We definitely saw our largest spike, as was demonstrated by the data that informs the matrix, right around the 4th of July weekend. And July continued to experience high case counts and numbers of people infected throughout almost the entire month. We've definitely seen a stabilization and even a decline in those numbers of positive cases reported per day. We would love to see that trend increase or continue to decline in terms of the number of positive cases, as well as those who then ultimately need our downstream services. We do note, though, in the last few days, we have started to see an uptick of about 100 or so more than we have in the past few weeks of people seeking testing. And this was relatively similar to the patterns that we experienced right around the 4th of July, although nowhere near as high the numbers. Again, with the holiday weekend coming, I really do want to impress upon people to be cognizant of the decisions that they make, to accept personal responsibility and to not place blame, because it really does take a community to make the difference. And I think, as Madam Mayor stated earlier, our best tools right now are continuing to social distance, although it's hard mentally and physically. The first thing you want to do is shake someone's hand or give them a hug. And I think that it's important to be able to take a deep breath and consider what the impact of that action might result in weeks down the line. And I really do want to impress upon people the importance of mask wearing as well. And then, of course, if you are seeking testing, and I think we have panelists who can speak more to this intimately, but if you are seeking testing, there's plenty of mechanisms to do so. Just because those are metrics that feed into this meter doesn't mean to shy away from that. We definitely need to know if you are symptomatic and you are suspecting that it could be allergies, it could be due to smoke, or it could be COVID. Don't play the gamble with it. It's best to just find out and know. It helps our hospitalists and our providers if you are for sure confirmed, because then they can protect themselves as well as our first responders. They can protect themselves when they are interacting with you, so that we don't promote the spread further into our community. And with that, I think I will turn it back over to Madam Mayor. She will introduce our next panelist.
All right, thank you so much. You really hit so many important points, and I want to say thank you. It's so so beneficial to know that you're at the health department. I'm super grateful and super thankful for your friendship too. It's nice to have women in the field, so thank you. And also I wanted to touch on, because some people might be criticizing this, and if you are, I just want to say that it's when we stop trying is when we really fail. We have to do whatever we possibly can to make sure that we keep people healthy and safe. And I know many of you are so anxious to get open. We all are. And you talked about it's so hard. I want to give you a hug and these things. And many of us are, want to stay healthy and safe. But by using this meter and modifying your behavior, we know that it works, and we can get those numbers down. So I'm a very competitive mayor. That's just the nature of who I am. And I want this community to show this country that we can be the model across the United States, to show, hey, here's a community called Reno that brought those numbers down significantly by modifying their behavior. And there's 3 major ones, and we all know that they work. And I know you might not like wearing a mask. I don't like wearing a mask. It's tough. I get it. But I do it because I want to keep others safe. I want to keep myself safe. And I want to keep our economy going. So it's wearing a mask. It's social distancing. Keeping that 6 feet apart is really important. And then the other one is wash your hands. Keep washing your hands. We know that works. I know it's tough, but we will get through this together. But I want you to prove that we can get those numbers down in Northern Nevada and be the model community that we can be, to show that Reno always comes out on top. And you guys know, in this community, we do. We always prove them wrong, and we are one of those communities where we make the biggest little comebacks, and you guys know we do. So please, let's do this together. As much as you might not like it, let's show that we can modify our behavior. We have a tool to do it now and follow. And I think, Heather, you made a great point. I also want to specify, but also really stress that when that meter goes down, it's not the time to let up on those behavior measures. It's the time to say, wow, what we're doing is working. Our numbers are getting down. It's helping us save lives and helping us save our economy. And this is the time for the Reno recovery. So thank you. You're amazing. So all of you guys, I'm beyond grateful. All of you just blow me away. And that's exactly who Reno is. We're full of talent and resilience. Next up, I'm very excited about this partnership. Everyone needs to know about this because I'm getting pinged a lot on Twitter. I'm not on Facebook typically, but I am on Twitter. I figure you can't get in that much trouble in 180 characters. So Twitter is sort of a quick way that I sort of check in, not every day, but I am hearing a lot of feedback on social media about testing. And this partnership is really exciting to me because it's something that this community has needed for so long. And I'm so grateful to Renown for bringing this partnership to us, because we know testing is really important. And what we also know about testing is it's critical to have these quick and fast turnaround times. And so this partnership that we've developed with Renown on testing is really, really impressive, and I can't wait to introduce Dawn Owner. She's the Chief Operating Officer of Acute Services at Renown, and she's brilliant, and we're lucky to have women right here in the room who are doing amazing things in our community, and I want you to talk about this great partnership that we're rolling out testing, because we finally have it, and I think it's tremendous service to our community. So go ahead and take it away, Dawn.
Okay, thank you, Madam Mayor. Good morning, everyone. I am Dawn Honor, and I am the Chief Operating Officer for the Acute Division for Renown Health. And I first and foremost want to say that Renown Health remains prepared to continue to safely screen, diagnose, and care for patients with respiratory symptoms or with COVID. So I wanted to say that first and foremost. But speaking specifically to testing, we've spent the last 6 months adding equipment and staff at Renown to expand our testing capabilities. We're currently performing about 2,500 PCR tests every week. We expect to have substantial additional capacity in the upcoming weeks. We have a piece of equipment that's going in as we speak, and we should be able to double our test capacity within the upcoming weeks. We are also operating a drive-through next to our South Meadows campus for convenience, and we're currently testing about 100 patients a day with a capacity for about 300 to 350 a day currently, and also working to expand that capacity. Our goal really is reliable testing with short turnaround times. We've spoken a bit about turnaround times here. Our current average turnaround time is 24 hours, and we continue to work on those, and we certainly have many that come back much quicker than that, but we continue to really focus as we add capacity on maintaining those turnaround times. So we are also very proud to partner with a number of local businesses, our school district, local casinos, in order to provide COVID testing for their employees, because we think that's very important. And we will continue to work hard to support our community, both with healthcare and with COVID testing. Thank you.
All right, I am so excited to hear this. I was having a conversation with Dr. Slonam, and he said we will be able to reach up to 5,000 tests a week. Am I right? Correct. Okay, that is impressive, 5,000 tests a week. And then also, I want everyone to hear this, the turnaround time is 24 to 48 hours. And can you give us specifics where these locations are? Can people, do they have to make an appointment? Tell us exactly how this works.
For the drive-through testing? Pardon me. For the drive-through testing that I mentioned, it is available Monday through Saturday at that South Meadows location. You'll see purple tents out there. We're currently operating 7 a.m. to 2:30 p.m. Monday through Saturday, so continuing to evaluate those hours as we go. So that's the best place for drive-through testing. You do need a physician order to go through there. Call your physician. We do work with our community partners to manage those employees through that location as well. So that's your best bet as a community member. I would encourage you to call your physician, or if you use a Renown provider, call 982-5000, and they will direct you to the best level of care.
If you went to where one of your locations are and there's an urgent care, can you get them there? How many locations do you have?
We have multiple locations. I would call first and contact them, and they'll get you to the right location. If you're symptomatic, they're going to want you to go through our drive-through or go to one of our lab locations where we're doing testing instead of going directly to the urgent care location.
Okay, and talk a little bit about some of the school kids, because they've all gone back to school, and I'm hearing some of them are testing positive. So, and there's been some concern that it's taken a while to get those results back. So maybe talk a little bit about that.
Our partnership with Washoe County School District is around the teachers and the staff for Washoe County School District, so that's who we're managing mostly through the drive-through location that I mentioned. The school kids are going through their healthcare provider, so Renown would certainly be involved with that if they were a Renown patient or a Renown.
Okay. That's fantastic. And also, I do want to mention the health department still has their testing. And Heather, maybe you want to talk a little bit about that so people know how to access that. Because I still get people saying, Mayor, how do I get tested? So along with Renown and the health department, this is going to be huge and help tremendously. So you talk a little bit about that.
Sure, absolutely. So at the health district, we are testing 5 days a week. We do our testing starting early in the morning. We do the drive-through testing as well. We have been doing this since late February and making improvements along the way. We have the capacity to test upwards of 800 a day if we needed to. Hopefully, we never get back to that point. We are testing about 100 to 200 about 200 to 300 people 5 days a week. If you do want to go ahead and get tested through the health district, you would go to the health district's page. There's multiple pages that have a link, but it says link to take a risk assessment. The risk assessment goes through a series of questions, and then we'll set you up with a profile to go ahead and go in and schedule and select a date and time to be tested. Usually we only open those up a couple days in advance, because what we saw is when we opened up too many days in advance, people would tend to forget that they have that appointment, and then we have no-shows. Also on our website, you can go ahead and call 775 328-2427, and you'll be taken to the COVID hotline, which will do the risk assessment over the phone.
Yeah.
In the event that you don't want to go ahead and click through the screens yourself, they will be asking you the same questions.
Okay.
And we do, on the dashboard, there is a tab there that actually shows all of our testing locations and little like teardrop icons, and you can click on all of them across the community. Renown, St. Mary's, Urgent Cares, we have, some of the providers or pharmacy locations like CVS and Walmart, and you can click on those and you can be taken to a link or a phone number to sign up for any number of those. So we definitely have a lot of options for testing throughout our community. I think one of the benefits of the testing that's done through the Washoe County Health District in partnership with our state lab and most recently with Charles Rivers Laboratory is that it is free and you don't have to have symptoms to be considered eligible to obtain an appointment. So I think that we've had to adjust that as we go
Right, because
through.
before, people were saying, if you don't
before-
have symptoms, don't get tested. But
Exactly.
now we have the capability, if you don't have symptoms and you want to know, some people have said, hey, I might want to go, see my mom, who I haven't seen in months, and
Right.
things like that, right? So now you have the capability, you don't need symptoms to get tested, correct? And you don't need a doctor, correct?
Correct, just the risk assessment. So that's
Okay.
how you make your appointment. And I just wanted to mention also, we recognize that there was some delays and lags and they happen, hopefully not with big groups, but that's why we've kind of worked with Charles River Laboratory in conjunction with our Nevada State Public Health Lab, because they receive the burden of almost all of northern Nevada, everywhere almost except for just Clark County. Essentially, they take on our inmate testing from our prisons across the state, and so we really wanted to make sure we weren't over inundating them, and they are caught up, and we hope to be able to turn around results within 72 hours, both negative and positives.
Okay, so thank goodness, now everyone needs to go get tested. Let's challenge the community, let's see. And all of a sudden, it's a mass. Is that exactly the same criteria? You don't need a doctor and you're encouraging people, even if they don't have symptoms, to come, Dawn?
For our drive-through testing, you do need a physician order.
Okay.
So Renown does require it for our testing right now. That's something we're evaluating, whether or not we make a change there. But we currently, as many of you know, testing has been a scarce resource. And one of the challenges, even if you have the equipment, is having the test kits. So our philosophy has been, we want to make sure that we are testing appropriately. It doesn't mean that we wouldn't test if you weren't symptomatic, but you still need the physician order.
But you could call Renown and a physician will help you get that order, am I right?
Correct.
Yes.
And
So
I would,
want everyone to think that, because a lot of times people say, I don't have a doctor. You can call Renown and they will put you in touch with the doctor to get you the order, am I right?
correct. And I would encourage folks to go to renown.org. We have a lot of information out there that,
Renown.org, and it's 24 to 48 hour turnaround time.
correct.
Amazing. Thank you so much. That is incredibly beneficial to our community. I want you to know that, both services, so thanks you guys so much. The other thing, another tool that we have here at the City of Reno that we just rolled out, and I think it's really important, especially to our small businesses who are struggling every minute just to hang on, and I know how difficult it is. It is tough times, and so part of our CARES Act funding, we really wanted to make sure that we could help our small businesses as much as possible, and so we have a grant program that we just rolled out with the CARES Act money, and it's up to $20,000. So I want our small businesses and encourage them to apply at reno.gov. Come and check out the criteria and see, that grant program, because we think it's really beneficial. I'm going to send it over to my good friend, Councilman Dare, because he and I are both passionate about business. We talk about it all the time. We serve on boards together, and he's a big champion for small business in the city of Sparks. I'd love to send it over to you, and I want you to talk about what you guys are doing in the city of Sparks to help your small businesses.
Thank you so much, Mayor Shivi. It's an honor to be here, and I have to tell you, I've been able to be back in these meetings, and in truth, I mean, obviously, I am not a doctor. Anybody who knows me knows I don't even like watching blood. I mean, I can't do it. But I got to say, sitting back and watching and being a part of this, we have some incredible experts in that meetings, and a lot of them are here, but truthfully, some of them couldn't be here today because of our distancing. And so it's just been an honor to be a part of that. I think one of the most important keys to this tool, though, and I'll start there and then dive into Sparks, is that we're working together. You know, if there's anything I could encourage, all of us to continue to do is to come and make sure we collaborate. One is it obviously saves money all the time when we can just work together, but it also, one thing that COVID does not know, it does not know where Reno starts and Sparks begins or stops. It doesn't know where the county or rural means. It doesn't know any of that. And nor do most people who live in it. And so we have to find ways to make sure we are coming together to find ways that we can just really be on the same plane, I would say it that way. And so as we really look forward, this tool, I would call it a tool of hope. And the reason I say that is because I know even personally in my own family, sometimes as COVID almost feels like we're on a roller coaster of information. And it's information that we don't understand unless you're smart as the people in the room that I've been able to hang out in, but it's hard. And so for your average person who lives in our region, it's just kind of sitting back waiting for the next hit, and the next problem. And so what this really does is it gives us the ability to see what's happening and not surprise us so much, because we can watch it happen. And I say that, I really do call it a tool of hope. And I say that it doesn't mean that we're out of the woods. It doesn't mean that it's just going to go down from here. We don't know that, and that will depend on our behavior. It will depend on what we do and how we use tools like this. But what will happen is that you get to be informed with the best information we can. We can use this in a lot of different ways. So we're already talking with the school district. There's a lot of questions, and my heart goes out to these kids. I mean, me growing up in school, if you gave me an excuse to not be in school and play video games, it would have happened every day. I'm just telling you right now, and I found ways to hide, even back then in school, how to do that. But watching this right now, it's really hard on these kids. I mean, it's difficult, especially when they just don't know what tomorrow's holding. And so I know our school district's looking for tools like this to help. I do want to reiterate that none of this will ever be, hey, we get here, we close something down. That is not what this is for. But it is to give them a tell, to say, you need to be paying attention. And once we get to certain levels, they will use this tool to stop and say, hey, maybe we need to look at what we're doing, and they'll make decisions based upon their view and their perspective. But that would be in every situation. I also think it's important we realize this when we talk about hope, not just for our families, which that is important in schools, but even our businesses. We spoke about that. I want to say this really out loud. There are some businesses open right now, and if you're a part of them, you might feel like everything's kind of moving and at least you can survive. We have businesses that cannot open right now. Not everyone is surviving, and there's people who've put their all of their nest egg into a business, and it's not open because it can't be. And so we really need to continue to see us move forward so we can be whole again and rolling forward. This is an incredible place to live. Reno, Sparks, Washoe County, the region, it's a fantastic place, but we really need to walk together. And I want to talk about one more thing before I dive into a few things on Sparks. I get to deal with a lot of people, whether it's with the chaplain work I do or city council or whatever it is, when it comes to mental health. We have a lot of issues going on with people's personal health, but mental health right now, when we don't have hope and we are constantly wondering about what might drop out, is a very big problem. And it's something that really changes how we approach our day when we feel like there's just too many unknowns. And if you're out there, you know what I'm talking about, because every one of us feel that. If we just have too many unknowns. So this tool, I believe, gives us some of that ability to kind of start looking and then also take it back into our own decision-making skills of what I'm going to do today. How am I going to decide to act? I know it's already been talked about, but I just want to reiterate that. Some of that mental health will come when you feel like your life is back in your hands a little bit. And that's part of why I'm actually really excited about this tool, Because I think we can sit here and look, and even if it's in the red, but the red, we're still moving in the right direction. And even if we're not, we know that we can do a little bit to shift that. And that's all we're asking, is that you do your part. No one knows exactly everything you deal with. Some of you have different health issues already. Some of them, I know people who can't wear a mask for different reasons. And so I say be patient with people out there as we go, but use this for you. It's a good communication tool. And so again, it's been an honor to be a part of this group, and I will continue as far as my time goes as serving our community or whatever. Always will look for ways to collaborate with Reno, with Washoe County, and us work together. Now, as far as Sparks go, I am excited to share, and I know every region's doing this. So with this, all of us have some CARE Act money that we're trying to find the best ways to do. We each have different perspectives or ways to do that, a different purview. And so with that, I only can talk about us, but it is exciting to know that we got about 19.2 million, 19.4 million in there of dollars that was given to us for these reasons. And we've already seen this happen. We've been able to give about $2 million, or at least promise, to the Reno Housing Authority. And I say that so as they use this to help those who are in need of making sure they can stay in their homes, that's $2 million out of Sparks for the city of Sparks, that we can help keep people in their homes. Now, the hard part is, I'd like to say it's not enough. We know that. And so the numbers I'm hearing, it still makes me worry that we still have a lot more to do, and we need to get businesses open. It's also, I'm excited that we were able to give $100,000 to the Delivering with Dignity, which will really equate to about 15,000 meals to men and women who should not be leaving their home because they're at risk. And so they sign up for this. They sign up with this under United Way, and United Way will assess who's there, and then they'll bring meals to you. And here's the other cool part about that particular thing. It actually supports the local businesses. They're not asking just for a donation from people to do this. We're actually paying them a decent pay so we can keep people working, but also bring really good meals into the homes, which I think is fantastic that we got to be a part of that. We also have allocated $85,000 to our CARES Act funding that's going to, from our CARES Act funding that was for rent remediation. And so, right now, I have a big concern of a tsunami of potential evictions. I don't know really all the numbers, and we don't know. And I know that people are either really happy or really sad that the governor did another 45 days. So if I know that if you are a landlord yourself, that might be hard. If you were getting removed from your house, that's really hard. So none of these situations are easy. But the one thing I think does help is when we can get these people talking with a plan. And so this particular program I'm very excited about, and I will continue to find ways to support it, because I think if we can find people, I think humanity will win. We actually, when I get to meet people in this region, people truly do care about each other. Put money aside, put these things. If we can just remind people that we're humans and that we need to care, you'd be amazed what we can do. And so I'm really excited about this particular program for that. Something else that's kind of neat, and this is something that's an investment for our future with these type of things like a pandemic. We've partnered with the University of Nevada, Reno on a nearly $1.8 million study to investigate the presence of COVID-19 virus in wastewater. I know that doesn't sound very fun to be a part of, and I don't have to go down and touch the wastewater, which makes me happy. But what they're going to be doing is researching this. And here's the amazing thing. In our community, if we do this right, we will know whatever issues we're having before it ever shows up out in the public, because we will be testing the wastewater and know. This will help local health agencies develop a predictive tool to assist in managing the pandemic and future things. So this isn't just for now. So this is one of those things that I think is a tool. It's going to be great. And we're all partnering together. It's not just Sparks doing it. This is something we're all working together. But it's a fantastic thing. And I am excited that we have money set aside for our business assistance program. There's some details we're still working out. But to me, we want to invest in our businesses as much as we can and get them back on the ground. And I'd say this in my closing, is just please know that we as a region are working together. And in saying that means we need you to as well. It doesn't matter where you live in this northern Nevada area. We get to walk together. And so please use this tool in that way. Let it be something that you really can utilize, and especially even this weekend. You're out, just be smart. I mean, we're going to enjoy ourselves. I'm going to enjoy myself with my bride. We're going to do some different things, but just be smart about what you're doing. Make sure that that you're being wise, because there are people at the other end of that decision. You know, one of the things I've learned being in office is the unintended consequences of our decisions. And a lot of times people get mad at us because of those. We know that. But a lot of times people don't realize that they have unintended consequences for their decisions as well. And so we need people to slow down. And hopefully this gives you a tool just to give you a pause to say, hey, what are my unintended consequences? How can I help? Maybe you can really do something that have intended consequences by making sure you do what's right as well. So thank you, Mayor Sheevy. Honored to be here always. And truly, it's kind of a different view being in Reno here. I don't know. This is, you guys' diocese is a little bigger than ours, but
I'll have to come to your place.
you're always welcome for sure.
Thank
But
you
honored to be
so
here.
much.
Thank you.
Thank you so much, and I always appreciate working with you so much because you're so incredibly caring, and you can tell kind of that preacher vibe you got, which I love because it's energetic and very cool, and so that's why I always like to hear your perspective because you really bring it down to, you know, the humanity and the kindness of who we are as a region, and that's, and you mentioned mental health, and you know how much I'm a huge advocate of mental health. And so thank you for being such an incredible representative for the city of Sparks. You're amazing. I'd vote for you if I could. Anyway,
Mayor?
at this point, I'm going to send it to we might have some media partners that want to ask some questions. I know this was long-winded, but we had a lot of information and we kind of wanted to give the community some hope. So I'm going to send it over to John Humbert. And you can let us know if there's anyone on the line that has any questions for our panel experts.
You bet. We've got a few people. We have Bob Conrad to start from This is Reno. You can go ahead and unmute, Bob. We'll circle back to Bob in a second. We'll have Cynthia with, oh, are you there, Bob?
No questions. Thank you.
Yep, no worries. We'll move on to channel 2 with Cynthia. Looks like you'll have to unmute, Cynthia, on your end. All right, we'll circle back. It'll be Jaden next. And we'll move one more time. We'll do channel 4. This Ben or Kenzie, you guys there?
Hey, this is Ben. I'm here. I don't know who would be best to answer this question, but I just, and a couple people had hinted at this, but this isn't meant to be, you know, the one metric that either, say, a school district or businesses or anyone relies on to shut down or open. And I just would like some more clarification on that and why that is.
Can you hear me, Ben? I'm going to send that
Yes.
over to Jeremy, Dr. Jeremy Smith, and Councilwoman Dewar.
Thank you, Madam Mayor. Yes. Well, you know, the intent of this was not to substitute for the good work of any administrator at an agency or a district or in your own personal business. It's really to create something for the community as a whole that gives you access to the data that's contextualized and allows you to make decisions for your personal behavior that can help us, minimize the spread of COVID-19 in our community. So it's not designed to think about the particulars of any given thing like the school district or shutting down restaurants or something like that. But everyone can still use it as that touchstone to what's going on with the data and what is the state of COVID in our community.
Yeah, and Ben, I want to reiterate, one of the things is, you know, those decisions are up to the governor. The governor's emergency directive supersedes our local government directive. But we were hearing a lot of feedback that people wanted a way to be able to look and see how we're sort of gauging how we're doing in our community. And we really felt like this was a great way to do it, but also people wanted to say, how can I help? How can I help? Well, we know how you can help, and that's by modifying your behavior. But how do we know if that's working or not, right? So all that data came into play, and that's exactly why we came up with this. This wasn't anything for, school districts or other agencies to use as a shutdown model in any way. This is a community tool, truly a community tool for people to be able to measure, their daily risk assessment.
Ben, if I could add, following on the mayor, sometimes analogies help. And in this case, I might use an analogy similar to a gas gauge. So a gas gauge is a tool, tells you how much gas is in the car. You also have a speedometer, and the speedometer measures how fast you're going. And you might have a speed limit, 65, and you might decide, it's raining outside, maybe I should slow down. And I use my tool to make a decision, I'm in the driver's seat, to slow down to 50. Maybe it's a beautiful day, no other cars on the road, and you might say, I'm going to risk it, maybe go 70. And that may even be the speed limit on that day. And finally, maybe it's snowing outside and there's ice on the road. And even though the speed limit's 65, maybe you, as the driver, as the decision maker, maybe you slow down to 30 to be safe. And so the tool is really giving you information. Using the car analogy again, maybe another light comes on and it says there's a problem with the engine. And maybe instead of continuing to drive, you're going to pull over to the side of the road. And so these are tools, these are gas gauges, speedometers, information that you, as in the driver's seat, whether you're an individual or an agency, can make your own decision. It's informative. I also wanted to add one other thing, Madam Mayor and Ben, and that is that who's really made this possible at this time is the Truckee Meadows Regional Planning Agency. Because as Jeremy said, just yesterday, they decided to adopt this work product and allow Jeremy to continue developing it. And one of the members on our team, I don't think got a mention, was Commissioner Von Hartung, who also serves on that regional planning agency and also has listed in with Christopher DeHare as one of your advisors to gain information so we can all better manage. So the whole idea is getting information and making decisions, whether you are yourself or an agency or an organization. Thanks a lot.
Yeah. Oh, I'm glad you mentioned Commissioner Hartung. He was supposed to be here, and unfortunately,
I know.
he couldn't make it, so I'm glad you mentioned him. Okay, Ben, anything else?
No, that's great. Thank you all.
All right. That means everyone did a great job of explaining when you don't have lots and lots of media questions. So good job. All right, everyone. Thank you so much for being here today. I really appreciate your time. I appreciate your expertise and everything that you've done in the community. I mean, honestly, I just can't even tell you enough how grateful I am. And I just want everyone to stay healthy and safe and take care of one another and just be kinder to each other. We could all use it right now. It is a stressful time for every single one of us. Times have really changed, but as a community, let's do this together. We are resilient, and I want to say thank you. So, all right, good afternoon, everyone. We'll see you later.
I actually do have one more quick question I just thought of if we still have time.
Oh, and we thought we were going to get away. Okay. Take it away, Ben.
Yeah, it should be real quick. Thanks for showing the the historic risk score going back to June. I guess I'm just curious, at the beginning of this, when things were shutting down and we were like really starting to spike, was it ever in the purple range, or did you guys not run it back that far to see kind of how high it got back in maybe March, April, and May?
Ben, great question. Fantastic. I'm going to send it to Jeremy because we've talked about this before.
Absolutely, Ben. Yeah, great question. We have run it back as far as we can. I think I'm able to get back into April. Some of the data streams aren't available all the way back. But in terms of looking at some of the shutdowns that happened early on in March, it was there. We just didn't have as much data at hand, and it would not have triggered the red based on what we had collected. If we were collecting like we are today, I bet you that it may have. So I don't really know how to answer that, but we can push it back, I think, into April, and I can try and make that available on the site too, so you can see the entire time series.
Yeah.
But it was a different set of information, and the novelty, I think, of coronavirus when the initial shutdowns were happening that we just didn't know.
Right.
You know,
Well,
one of
and-
the hopes is too that we can, to build on that time series. Some of you have seen some national graphs that show how coronavirus changes either internationally or nationally in terms over time. And I think one of the cool improvements or add-ons to this tool could be to be able to look back in time, start at the very beginning and go forward and see how we have progressed through the different colors. I mean, that's something, again, that with the support of the Truckee Meadows Regional Planning Agency and that governing board, that might be really something that you move out on.
Yeah. I would like for you to elaborate on that, Dr. Nielsen, because let me ask you, what I've also heard is that there's belief by us shutting down early that also helped tremendously as well. Can you talk to that?
Yeah, we were quite lucky in really mid-March when we did a pretty abrupt shutdown of the schools and businesses. Just when we saw that some of the disease was coming over mostly from California, and that probably bought us, months of time. I mean, there's a reason why we've done relatively well for a population center of almost 500,000 people. And I mean, we did it early and we did it well. And I mean, everybody kind of loosened up a little bit in summer, I think, and that's why we had some spikes. But I think if people really stay focused, especially on mask wearing and distancing, I mean, we got to, stay the course. But I think if we didn't do an early shutdown, we would not be in such a good position we're at now.
Yeah, that's really encouraging. And especially you, I mean, you're the first person I kind of run to because you're seeing it every single day. You're living it. You're living it. So, I mean, it's just incredible to have your knowledge and feedback. I think we all see those national stories too. And we say, oh, that's in Iowa or it's over here. But you really bring that home, you bring it home to that perspective of what's really happening. So, and it's great, again, gives us hope that we know what we've been doing, and even though it's been super hard and painful, that it's working.
Yeah, I mean, we want to be an example in the country of a community that did it right and did it locally and did it ourselves. Because really, there's no one else. There's no one else but us, right? I mean,
Right.
this is it.
Right. Good points. All right, Ben, did that help you?
Yes, very much. And then hopefully this last one's real quick too. Has there been any interest from, other regions, maybe Southern Nevada, Northern California, any other counties in Nevada that are looking to adopt this? I know you guys had said kind of the metrics and all the coding is public, so any other local or region could theoretically take this and kind of make their own meter, right?
Right. So that's how come Jeremy is so brilliant. I'm going to have him answer that question. Go right ahead, Jeremy.
Well, I don't
That's what I
thank
love
you. I don't know about
this.
that. But,
Sharing is caring.
yes,
Yeah.
it is the kind of thing that anyone could take and modify themselves. It's open source, coded in open source Python coding, so we can make that available. And all of the model assumptions and whatnot. Jack Hester is on the team. Has been working on a document we're going to try and get up on the website later today, so that folks can see exactly where the breaks are and how everything works. And happy to pass it on to anyone that wants to try to use it and even have a conversation about how to get the data and move forward.
That's fantastic. I love that. So maybe different counties can use it, different cities can use it, and I don't know what Python means, but it sounds really
Oh, well, it's free.
really interesting.
Yeah.
I love it. Was that helpful, Ben?
Yep, that's all for me. Thank you, guys.
Okay, thanks. All right, John, anyone else? We're good? All right, perfect.
Goodbye.